Dr. Schuman, you presented the Sutro lecture at Glaucoma 360 this year. Could you give a synopsis of what you presented?
Sure. My Sutro lecture was on OCT, past, present, and future. And I talked a little bit about the development of OCT, the invention, development, where we are today, and where it's likely that we'll be going. And from the initial days when we were first looking at imaging the retina and whether or not we could image the retina, to being able to do actual clinical imaging patients, to today where we're using spectral domain OCT really to do 3D OCT imaging of the retina and the optic nerve, and OCT is guiding our management in glaucoma, in retina, in many diseases in the eye. And I think that in the future, and what I talked about, was using OCTA in glaucoma based on some of the work that David Huang has done, and also the possibility of being able to do tissue biochemistry, metabolism, really oximetry. These are things that we can't do today, certainly not clinically, but it's likely that the technology will continue to evolve to a point where we are able to do those things.
The evolution of the OCT. At first, the first two stages were but it really took off in the OCT 3. Did you ever question that this would not come to fruition?
Well, I think that all of us who were involved in the development of technology knew that it was amazing in terms of being able to see things that we could never see before, and we believed that this would be helpful in glaucoma diagnosis, in diagnosis of various types of macular pathology, in detecting progression of disease and guiding treatment. But I don't think that any of us imagined the degree to which it became helpful. Now it is ubiquitous, and really globally, it's a technology that's used for the care of patients. So I don't think that we had a good impression of exactly what would become of the technology.
The technology in OCT has just been incredible. It keeps evolving and evolving, and you're talking about 3D now, as you mentioned in your talk. Could you, what dimension does that bring for the physician?
So the third dimension.
Yeah.
So the third dimension allows us to do volumetric imaging, and this volumetric imaging permits you to section the image in any way that you like, so that you can look at specific portions of the tissue where you might get the most bang for your buck, where the pathology lies. In addition, for surgical planning, especially in retina, the 3D OCT can be very helpful in showing you where the attachments of the vitreous are, where the PVR is, what sorts of things are happening in the tissue that you're about to operate on, and where you need to pay special attention. Intraoperative OCT, which I didn't talk about, allows surgeons to make sure that they've done what they think they've done. Have I peeled the ILM? Have I gotten all of that epiretinal membrane? And so that can be very useful as well. I think that intraoperative OCT is really in its infancy. And actually, I foresee a day when intraoperative OCT will allow us to do real-time three-dimensional OCT and use OCT as image guidance for intraocular surgery, and maybe even to guide robotic intraocular surgery in the future.
Do you see OCT? I mean, you look at OCT and how it's progressed, but what's the next level?
I do think that tissue metabolism, biochemistry, oximetry are probably the next places that we'll be able to make advances with OCT. We've seen things now that we've never seen before, and the introduction of OCT angiography, its rapid adoption, and its development quickly by the various device manufacturers has really made that available to the clinician on the street. We still need to understand what it is that we're seeing, But I think that, you know, going forward, we're going to see further advances like the ones that I just talked about.
Sounds like the future is going to be great for OCT.
It's looking bright.
Thank you, Dr. Schuman.